Hi everyone! Rainy season is fun. Rains, holidays vibes, and cool weather. But for students, it also brings a small health twist. Germs spread faster, and that's when fever, loose stools, cough, and skin problems start popping up. Welcome back to Beware Podcast. The students will learn real life topics in simple, friendly English.
Today we have a very important guest, Dr. Baiju. Doctor will show students how to spot symptoms and prevent rainy season infections without panic. So students, keep your attention on this episode. It will help you stay calm, stay safe and take right steps. Ready? Let's begin.
Doctor, rainy season infection sounds scary. In simple words, what makes monsoon different from our health?
So very interesting question. So monsoon is about to come. So no, it's going to start in June 1st.
Yes.
So actually monsoon is a season of diseases in Kerala.
Okay.
So it starts in June and it extends up to August, and after a short break again starts in September and ends by October. In Kerala, we have two types of monsoons. Number one is southwest monsoon. It starts in June and ends by August. And after Onam, there's a break, small break. Then comes Idavapadi. It's called in Malayalam. It is called Idavapadi.
Yes.
That's the northeast monsoon. Then it starts in September and ends by the end of October. So why these infections and communicable diseases are more in monsoon? Have you ever thought of that?
Yes.
So there's a reason. There are two reasons for that.
Okay.
Number one is increased humidity or water content in the atmosphere.
Yes.
So naturally there is continuous rain, so there will be the humidity of the atmosphere will be very high. So what happens? So that makes a favorable situation or condition for the growth and multiplication of microorganisms. So most of the diseases are caused by microorganisms like bacteria, viruses, funguses. Okay.
Okay.
So such organisms will multiply and flourish and spread to the environment, infecting us, causing diseases. That is number one reason. Number two, there is stagnation of water around us. You can see collection of waters everywhere.
Yes.
What is the problem with that? That makes a favorable situation for the growth of vectors. So which are the main vectors in our community? That is mosquitoes.
Yes.
Can you say a disease caused by mosquito?
Thank you.
Dengue fever, very good. Dengue fever. And then typhoid, cholera spread by houseflies. So when there is water collection, all these insects will grow and multiply, spreading the diseases. This is the main reason for the increased prevalence of communicable diseases in monsoon. Clear?
Yes. What are the top 3 infectious diseases that students should watch for the everyday life?
During monsoon season.
Yes.
So many infections. A lot of infections are there during monsoon season. However, there are important infections also. For better understanding or easy understanding, we can classify the infections into 3.
Okay.
Number one is droplet infection. A disease is spreading through the droplets. So suppose if you get a disease, you have sneezing, cough, then you will be spreading the infection around, and that will be affecting other people. Number 2 is waterborne diseases. Waterborne diseases means disease spread via water. And number 3 is vector-borne diseases, insects spreading the diseases.
Okay.
Of the important 3, I think in Kerala, during monsoon season, number 1 is dengue. That's a vector-borne disease spread by, as you told before, by mosquitoes.
Yes.
Another important waterborne disease, that is cholera. Last year also we had an epidemic of cholera in Alleppey. So very dangerous. So it is characterized by vomiting, diarrhea and all. And finally, it's very serious infection, patient may die. That's very important. That Then third one, again droplet infection, that is influenza. It's very common in our community. It's very important also.
Okay. How do waterborne diseases spread like loose motion or stomach infections? Can you explain the chain in an easy way?
Yeah. There's in a simple sentence, the reason is fecal oral contamination. That is fecal oral contamination. Suppose a person is having diarrhea and vomiting, then he will be frequently going to the toilet, and he is not washing his hands and all properly, and he again serves food to others. What will happen? Automatically the disease will spread. So personal hygiene is very important. There's fecal oral contamination. That's called fecal oral contamination. So whenever you have diseases like vomiting and diarrhea, you should not serve food to others. You should be very clean. Every time you may be going to the toilet, and each time you should wash your hands with soap and water.
Okay.
So you should be hygienic, otherwise you will be spreading the disease to others. Is it clear?
Yes. If a student has a stomach pain or diarrhea during rainy season, what are the first things they should do at home?
We have a lot of things to be done at home. Have you ever got such a problem?
Sure.
Me also, many times when I was a school-going student. So number one, so whenever a person gets diarrhea or vomiting, there will be associated stomach ache, severe stomach ache. That's the main concern. So for that, you can use lemon tea, ginger tea is very good. So that is because of the intestinal spasm. So this diarrhea and vomiting is due to infection. It may be due to entry of a virus or a bacteria or some organism into the intestine. So the intestine will be in trouble. So it tries to expel the contents. That's why the pain comes.
Okay.
So that can be relieved by using home remedies like ginger tea, lemon tea, etc. Second thing, so we are each time after going to the toilet, we are losing fluids, water. So diarrhea means watery, or vomiting means it's watery, that we are losing water. That results in dehydration. That is dangerous. So we have to take plenty of water, not as a whole, but little. Otherwise you will vomit again. Not a huge quantity or big quantity at the same time should not be taken. Little fluids you can take. So to prevent the loss of water, not only there will be associated loss of salts, minerals, etc. For that you can use ORS. Have you heard about that, ORS?
Yes.
Oral rehydration salt, that is available in the medical shop, that you can keep at home. That you have to dissolve. There is a how to dissolve, that instruction is there over the packet itself, sachet. So accordingly you can dissolve in water and take little sips. Then you can prevent the dehydration. That's number 2. But there can be serious symptoms because the child may be very tired. So if pain is not relieved by the home remedy or associated fever, if such dangerous things are there, you have to go to the hospital. Then you should be careful about your diet also. You should avoid something. So you should not increase the load of the intestine because the problem is in the intestines. Am I right?
Yes.
So you should avoid heavy meals. Especially be vegetarian. Be vegetarian. So when you get such a problem, vomiting or diarrhea, be vegetarian. So you can use kanji.
Yes.
So that rice water is very good. Salted rice water is very good. That gives you energy.
Okay.
Then coconut water is very good. Coconut water gives potassium, and this salted kanji water gives sodium, glucose. So you will be all right. These are the things to be done to prevent dehydration. Then diet also, you can take bread, bananas, toasted bread. That's called bread diet. Something is there called bread diet. That's bananas, B for bananas, then R for rice, then A for applesauce, then toast, bread toast. Like easily digestible food you can choose.
Okay.
Okay, these are the first things I think to be done at home. And if these first aids are not working, go to the hospital.
Okay. Doctor, people often confuse fever types. How can a student recognize when it might be something like dengue and not just normal viral fever?
Very important and interesting question. Because fever is not a disease. That's the first thing you have to understand. Okay. Fever is not a disease. It is the sign of a disease. So when you get fever, you get something has happened to me. My body temperature is going up. Some infection is there. Some microorganism has entered my body. So it's a warning sign. So number one, fever is not a disease, it's only a symptom. So there can be an underlying infection. So a virus may have entered your body, a bacteria, or it may be a protozoa, it may be a fungus, any other organism. That is something to be detected by the doctor in the hospital.
Okay.
But usually in monsoon, fever is very common. So most of the fever cases are not dangerous, very mild. It's called a simple viral fever. That will resolve in 2-3 days. Till then you can take hot water, then cold sponges. So when you have temperature, then paracetamol according to the dose prescribed by your doctor, so that your parents can help. So the dose is something to be decided by your body weight, not by your age. So your family doctor knows the body weight and she needs this much paracetamol. That idea is there in your parents, there with your parents, that idea is there. So you should not self-medicate, that's dangerous. So you try, you take rest, and I think it's better to stay at home. Because if you go to the school, what happens? You'll be spreading the disease to others also. They will be in trouble. So these are the precautions that to be taken. So if there is any danger, suppose if the fever goes very high, then hospitalization is needed.
What are the red flags of fever that parents should not ignore, like signs that mean don't wait?
Yeah, that's also a very important question, because as I told you before, so viral fever is very common. You may get viral fever during rainy season. Okay, you are doing first aid, waiting for 2-3 days. It's okay. But there are some dangerous signs or red flags, as you told me, so which we should be taken care of.
Okay.
Number one is very high temperature. So you may be having a thermometer at your home now. Do you have?
Yes, I can.
Yeah. Then check the temperature frequently. So if the temperature goes above 103 degree Fahrenheit or 39.4 degrees centigrade, then it's a dangerous sign. So you have to immediately admit the patient, or you have to consult your family doctor. Number two is disorientation, because of the fever, you loses your memory and you don't know where you are, like that, with confusion. That confusion if comes, then also you have to, it's a dangerous sign. Again you have to go to the hospital.
Okay.
Then third one, neck stiffness. Have you heard about that? So neck stiffness associated with fever. The patient is not able to turn his neck like that, stiffness. It's a very dangerous sign, because the infection may have spread to the brain. Suppose if the fever or the organism, virus or whatever it be, if it is going to the central nervous system, usually these pathogenic organisms will not go to the brain. So that is prevented that way. It's called blood-brain barrier. So if the organism crosses the blood-brain barrier, reaches the brain, so that's very dangerous. That's called meningitis, encephalitis, etc. That's a very dangerous sign. Then chest pain. Then breathlessness may be a sign of pneumonia.
Okay.
Chest pain. Then as we discussed before, severe vomiting, diarrhea, again it's a dangerous warning sign. Another thing is, very important thing is decreased urine output. Have you heard about Weil's disease?
Yes, I think.
Yeah, leptospirosis. Leptospirosis is transmitted by rats. That's also common during rainy season. So, in such a case, the patient will be having decreased urinary output. Urine flow is reduced to a dangerous level that will affect his kidneys, heart may be damaged. So, that's a very important warning sign.
Okay.
Usually, I think these are the dangerous things you should be careful about.
Doctor, can infection spread even if someone doesn't look very sick? For example, if a person has mild symptoms, can they still transmit disease?
Yes. So, it's a very good question. Again, you are asking good questions only. Very important also. Such patients are there. So, they are called carriers.
Okay.
It's a very important word, carrier. Carrier of the organism or carrier of the virus or carrier of bacteria, whatever it is. That he carries the organism, disease causing organism, and spread to others, but he is not having any symptom or sign. Best example is COVID.
Yes.
COVID, you remember COVID?
Yes.
Okay, how old are you now? It was
I'm
5 years
12
back,
years
I think,
now.
COVID.
12 years now.
Yeah. You remember the epidemic of COVID? Yeah. COVID-19, there were thousands and lakhs of people carrying the virus in his body, but without any fever or discomfort, any sort of discomfort. They are absolutely normal externally, but the virus is there and they are naturally spreading the disease to others. That is very dangerous, because if you have any problem disease, you will be remaining at home. You won't go out. But if I am not having any disease, naturally I will go out and spreading the disease to everywhere. That has happened in the case of COVID. Okay. So there are other diseases also. So as I told you before, viral fever also. Some people may not be having enough signs or symptoms, or they will take first aid medicines and suppress the symptoms, and they will go for work. The work is because daily wages, cash should be there, no? So they will go for work and taking simple medicine, suppressing the symptoms. That is dangerous. Another important infection is pulmonary tuberculosis, TB, commonly called TB, pulmonary tuberculosis.
Okay.
Patient may not be having enough much symptoms. So there may be light fever at night, nobody knows. There can be light cough once a while, but he will carry the organism and he will definitely spread to others.
Okay.
Then another important disease is waterborne disease, fecal oral route. I told you before, that is typhoid. There's a story also about typhoid. So one lady, her name was Mary Mullen, in 19th century. She was a cook.
Okay.
She had this typhoid disease, but she never had any symptoms. She carried the organisms in her intestine and gallbladder, and she cooked food and served food to others. Many people consumed food and got typhoid, and 3 people died of typhoid. So there were no enough treatment during that time for typhoid. Those the health workers, it happened in the US in 19th century. Health workers started investigation, and finally they reached the place. They detected that this lady is having typhoid. She was sent for quarantine, and later she is popularly known as Typhoid Mary.
Okay.
Like that, so many diseases are there which will not show any symptoms, but so even mild symptoms you should, so if it is prolonged, then you should consult your doctor. That's better than get all investigations. So everywhere you have facilities, good facilities for health checkup and all, you find the disease as early as possible and treat it. That will be easy for the doctor also. So in the beginning, the very beginning, if they can find out any disease, then the treatment is also very simple and easy. Otherwise, you may go into complications.
Okay. Respiratory infections like cough, cold, sore throat also increase in monsoon. How do they spread and what simple precautions work best in schools?
Respiratory infections are very common in monsoon, as we discussed already. So, number one is influenza, number two, viral fever, common cold, then pneumonia, throat infections. So, all these health issues have a common factor. That's they are all spread by droplet infection. So, suppose you have a common cold or you have influenza, you have bronchitis or pneumonia, the patient will be sneezing and coughing continuously.
Okay.
So, he is spreading the droplets, the saliva or nasal particles, small droplets with the pathogenic organs, with the virus. The virus will be there in the droplets. So, you will be each time you will be sneezing, after sneezing or coughing, this will be spread to the surroundings. Usually, such droplets can spread up to 3 to 6 feet away. So, the surrounding people are not safe. Definitely, they will inhale. So, the droplets are spread in the atmosphere. Naturally, other people will inhale. So, the organism will enter their lungs and eventually the complete body. And he will get the disease after a few days. Like that is spreading. That's called a droplet infection. How can you prevent that? So, there are so many preventive measures. So, the droplet infection, number one is using a mask.
Yes.
If you have a mask, so the droplets will not spread to others. Then, see, if you are not having a mask, you should carry a handkerchief or a tissue. Using that, you can close your mouth.
Okay.
So, if you are not at all having all this, you are not having a mask, you are not a kerchief, tissue, nothing. Just hold the hands like this. So, when you cough and sneeze.
Okay.
So, when you are in a classroom or in a public place, so crowded place, immediately you have to close your nose and mouth like this.
Okay.
That is not the end. You have to wash the hand immediately after that. So the droplets will be there on your hands.
Yes.
So immediately wash the hands with soap and water. Then try to keep social distancing. That is called social distancing. So try to stay away from others when you are sick.
Okay.
Or be safe at home. You may lose some classes. Okay, you can study or you can get the notes from your friends.
Yes.
You can adjust somehow. So this preventive measure is very important.
Okay.
Okay, clear?
Clear. What are the most common myths students follow during rainy season, like taking antibiotics automatically, or avoiding drinking water, or using random medicine?
Okay, so in monsoon season, and as we already discussed, so many infections are there. So usually, as I told you, there can be viral infections, there can be bacterial infection, protozoal, so many types of microorganisms are there. So whenever you get a fever or associated disease, you will get dehydration, that is loss of water.
Okay.
So you take plenty of water, warm water, that is rehydration. You rehydrate your body, that's very good, be healthy. But taking antibiotics cannot be entertained because, so suppose you get a fever,
Okay.
it is caused by virus. Then there is no point in taking antibiotics because antibiotics means medicine which kills bacteria. Suppose if it is a bacterial fever, so you have fever and it is caused by bacteria, then okay, antibiotic, you are taking antibiotic, the bacteria will be killed, okay, everything is fine. But what is the point in taking antibiotics in viral diseases? No. So you cannot understand which infection you have got. So for that you need the help of a doctor. So antibiotics should be prescribed, taken only with a doctor consultation. So you consult your doctor, you confirm that you have bacterial infection, then you take antibiotics, he will prescribe you, no problem. Otherwise, taking antibiotics to prevent fever is absolutely dangerous and nonsense, that I should say. So depending on another example, so suppose you get a fever, Weil's disease or leptospirosis, then a particular type of antibiotics, antiprotozoal antibiotics are used. Then viral fever, usually we don't use antiviral drugs. So the drugs that kill viruses are called antivirals, not antibacterials.
Okay.
And drugs which kill fungus is called antifungals. So there are different types. Antivirals are there, antibacterials are there, antibiotics are antibacterials. Then antifungals, antihelminthes, antiprotozoal, like that, so many medicines are there. So if it is a bacterial infection, antibiotics will work. So if it is viral disease, usually viruses are not harmful normally. So most of the viral diseases are self-limiting, so in 2-3 days you will be all right. But there are dangerous viral diseases like influenza. So when you get influenza, doctor will prescribe, not prescribing antibiotics, antiviral medication. So when you get chickenpox is another viral infection. Then also you will have to use antiviral medication, not antibiotics. Similarly, if you get a fungal infection, then you have to take antifungal medication. That is something to be decided by the doctor. So self-medication is very important. That should be totally avoided. Okay.
If a student gets sick during exams, what should they do to recover safely and avoid spreading infection to others?
Yes. So during exam season, you cannot avoid examinations. You have to go now. First of all, when you are sick during your examination and you think that you cannot appear for the examination, or you are very tired, or there is a chance of infection to the other students during exam season, is very dangerous. So immediately you have to inform your HM or principal or head of the institution via your parents. Parents should approach them and inform that my son or daughter is sick, but he or she wants to write the examination. Then you have to produce a medical certificate also from the treating doctor.
Okay.
He can give an idea, and the message will be passed to the authorities. So this student is having this type of infectious disease, so the other students should be protected, like that. Then give an application, and you may be allowed to sit in the same room at a distance. As I told you, a distance of about 6 feet is safe. So in the exam hall, you may be allowed a separate seat away from the other students. So you can write the examination, at the same time the other people are safe. Another thing that the school authority can do is making a separate room for you with an additional examiner. For that, they need an additional examiner. In serious infections like chickenpox, then you try for supplementary exam. So you can write the exam later if it is not public exam. These are the things to be done, I think.
What are the important habits we should start from today?
Okay. So the habits to prevent diseases that we can classify into two. Number one is personal hygiene. Number two is social hygiene. Both are important.
Yes.
Personal hygiene should be there and social hygiene also should be there. That I will tell you, I will explain. Let's take personal hygiene. So daily bathing,
Yes.
your oral, dental caring, toilet hygiene. So after going to using toilet, immediately wash your hands with soap and water. That is must. You should practice it from today itself, or I think you people are having such a good habits. Number 4, hair and nail care. Number 5, you have to clean your rooms and home. That's very important. Number 5, personal hygiene, that is proper rehydration. Proper hydration. You take plenty of warm water during monsoon season, that will protect you. If you stay hydrated, then you can prevent so many diseases. Then about social hygiene. So whenever you get a communicable disease, you try to wear mask. That's a simple and cheap way of preventing spread of diseases. Another thing is cleaning the surroundings of your home and the vicinity of your school, that you have to keep clean and safe. And number 4 is quarantine. You stay at home. So whenever you get an infectious disease, to protect others, so in order to prevent the disease, you be safe at home. And these are the things that you have to practice from today.
Thank you so much for your valuable advice, Doctor.
Thank you. So I think you have to keep the advices from today itself, so that you and your friends will be safe during this monsoon. Okay.
Sure, Doctor.
Thank you.
Students, before we close, let's lock in the most important takeaway. Rainy season doesn't only bring rain, it brings infections. And infections can be prevented with smart habits.
That's it for today on BVM Podcast. If you learned something useful, share this episode with your friends and classmates. Stay safe, stay healthy, and we will meet you the next episode of BVM Podcast. Bye.